can one reduce the impact of memory loss? That's an interesting question, isn't it?
Yeah, it's multiple things that research is not so clear-cut on that at the moment, but there are a few things that we know about. One is balanced health style, two is control all that you can control.
So I think what comes to mind first is when it comes to memory issues is dementia. Dementia has it's a broad spectrum, but I think at the end of the day it causes memory. The key thing is memory problems, cognitive
Impairment.
impairment. Okay, and most of the times it's their short-term memory that's affected. A lot of them have long-term memory issues. That's on one side. On the other side of memory issues is recently we've learned that menopause impacts your memory significantly. Mental illness also impacts your memory. But at the end of the day, the key is memory loss. I am thinking, I don't quite understand what the person wants to know, but what I think that I always advise, the person who has memory loss needs help, especially if it's progressive and advanced, like a lot of care. Sometimes they need one-on-one care because they need somebody around them all the time to supervise them. So that helps them at least because some of them don't recognize who they are, they don't recognize who their family members are, they don't even recognize where they are at any point in time. They don't know the dates, they don't know the days of the week. So that can sometimes cause frustration, which manifests in as behavioral problems. They get aggressive, they get violent sometimes because they are frustrated and because of their situation. So overall, they do need a lot of help. To minimize the impact, I think that's what you need. You need help in the form of caregivers to provide that one-on-one care for them. Sometimes, for those who are not very bad, we help them by putting up pictures, putting up charts. Family members, you have a clock, and you write the time. You have pictures of family members to remind them who each person is. You have pictures of various things like, the month, the day, and all that. Essentially, it comes down to care, providing care, okay? Providing a caregiver for them, whether it's one-on-one or at least somebody around.
Right.
I would like to chip in on what he said, in addition to what he said. I'm not sure whether the question is addressing prevention or the causes itself, but like you mentioned, the causes are myriad from multiple things. Some is familial, some other ones is traumatic from a trauma, some psychiatry, some medical issues also cause that. So if you have like part of the spectrum of the untreated diabetes, high blood pressure, and other medical problems, you probably end up with some form of dementia. One of the ones from diabetes is the hypoglycemia, when you have very low blood sugar. Unlike high blood sugar, where you have the nerves being just altered, in low blood sugar, your brain cell actually is burnt out, it's dead, it's going to be replaced by a scar. So very low blood sugar is part of the problem. So you can imagine what starvation and hunger does to the brain. So it stops your growth, it changes um, the tissue itself, the nerve endings. So backing from that too. So basic thing is diet and exercise, and then excess alcohol use also causes that because you're denying your brain some nutrients. So you could end up with like what we call Korsakoff neurosis and Wernicke's encephalopathy. And some of them, if it continues ongoing, becomes more permanent, or you never come back to your baseline of mental function that you had before the event. So continued insult on the brain leaves scars on the brain. We also have the one from impact, like trauma from playing football, American football. So there are so many things that cause that. So everything boils down to lifestyle changes, whatever you're going through, control it, and every lifestyle changes in moderations, excess alcohol, no excess smoking, no use of drugs, and diet and exercise plays a good role in this too. I do remember a research that showed that eating a lot of berries, especially colored fruits, all have brain protective or dementia protective effect qualities. So all those colored fruits, berries, are part of the lifestyle modification that could help reduce or prevent dementia. And then quality of life. So you're sleeping properly and working good set of hours. So no extended set of hours of work for prolonged period or or not messing around with your sleep cycles too frequently. So all those things do everything leaves a mark on the brain, and you don't want that to be a continued insult that will end up with scars that will be your dementia.